My name's David Butt and I'm a shoulder and elbow surgeon here at One Hatfield. My NHS base is at the Royal National Orthopaedic Hospital in Stanmore. First of all, I'd talk to them about the elbow problem and how long they've had it and how it's interfering with their daily life. Is it painful? Is it stiff? Is it a functional problem? Is it more the pain that they're trying to deal with? How long they've had it and what exacerbating factors are. And so to get an idea of exactly what we're dealing with. And that may lead to more detailed questions about the elbow or about general health and other associated conditions. And that information is very useful to start to understand what the problem might be. And then I would also examine them thoroughly to see how the elbow moves, how stable it is, what the muscles around are like, and really how the whole limb functions. Again, to build a picture about what the problem is and what they might need in terms of treatment. In most cases, an X-ray is needed to give a bit more information of the bony structure, but X-rays don't show the soft tissue, so often further imaging, sometimes CT scan, which is a 3D X-ray, but also MRI scans and ultrasound scans can be useful to determine the exact problem and then plan that any treatment that's needed. Commonly, elbow problems are soft tissue, such as tennis elbow, which many people have heard of, golfer's elbow, but that doesn't mean that those conditions aren't intrusive. They can be very intrusive, very persistent and very painful. Fortunately, we do have some fairly established treatments that do work, and only a small part of that is usually surgical treatment, but if necessary, surgery can be very helpful for the treatment of chronic tennis or golfer's elbow. I also treat problems with the nerves around the elbow, particularly the ulnar nerve, which is the funny bone. Everyone knows it when they bash it. And problems with that nerve can be associated with various other elbow conditions, particularly with stiffness and with arthritis at the elbow. But it may be just a simple procedure to decompress the nerve, that's all that's needed in order to improve pain. So there are lots of different causes of pain, lots of things to look for, but often relatively simple solutions for many of those. In terms of pain from the elbow, if it's not a soft tissue problem, it could be coming from the joint itself. And there are lots of things that could be causing pain, but notable ones would be instability or degenerative change or arthritis of the joint. And obviously there's various different treatments depending on what the underlying problem is. But typically you would start simple, again modifying activity so to avoid what causes pain. Simple exercises to try and strengthen up muscles and improve the function and gain range of movement. And also injections into the joint, and they can be injections of steroid and local anaesthetic, occasionally other substances, for example PRP, depending on the problem. One of the procedures that I perform for elbow arthritis is a keyhole operation to remove extra bits of bone that have formed as part of the arthritis and to release the soft tissues that have stiffened up, again as part of the disease, to try and regain both range of movement and to also improve pain. And that can be a very rapid improvement. Typically after the swelling settled, usually taking a few days, patients already notice the improved range of movement, and after a few weeks they tend to feel much better in terms of pain and function from the arm. And that's done as a day case, again with a general anaesthetic and a block so that they don't have much pain afterwards. That's a nerve block which prevents any sensation in the arm but also prevents the pain for about 24 hours. And so following the procedure, once that has worn off, they don't typically need a huge amount of pain relief and can get going pretty quickly. And when successful, it can transform the function of the arm for several years and stave off any further surgery, such as an elbow replacement, in that time. So occasionally we do see more acute elbow problems in the younger patients. One notable thing is what we call osteochondritis dissecans, and that's a problem with the cartilage and the underlying bone. It particularly affects the outer side of the elbow, and it can present often in throwing athletes in the kind of adolescent ages. Just a persistent pain that gets worse with those activities. It's not entirely known why it occurs, but it can result in parts of the joint becoming separated. And in most cases, you just need to identify the problem and then rest until it heals, but in some it does require surgery. So if you're worried about your elbow, you've got pain, you've got stiffness, you've got difficulty in using it for work or for sports, you should get in touch with One Hatfield team, and they can book you an appointment to see me where we can discuss it, we can work through what the problem is, and we'll come to a solution.